Hi guys, Mrs. Hall here. This is a short video on the use of an infusion pump. With the kind courtesy of some of our nurses, we have got a full video on how to use an infusion pump. According to the FDA, an infusion pump is a medical device that delivers fluids such as nutrients and medications into the patient's body in controlled amounts. They are found in hospitals as well as some homes. Infusion pumps generally require a trained person to program it to deliver fluids at a rate and duration that was ordered. These offer a significant advantage in delivering very small volumes, precisely programmed rate, or even automated intervals. We generally use the pump to deliver fluids to critically ill patients or pediatric patients, but they can be used also to deliver things like antibiotics, chemotherapy, and pain relievers. There are many different types, but the one that we're about to review is the one that is typically seen in healthcare settings. In order to set up the pump, we would use the required fluid and prime the fluid with a drip set that is to your liking. Hang the fluid on the drip stand and open the door lever, where we will find the controlling portion of the pump. The tubing is first laced through the tube guide located at the upstream, then run through the guide for the air detector. It goes across the finger cassette, where the tubing passes in front of the occlusion sensor, finally passing through the tube clamp, which prevents free flow. And then its journey through the pump is complete at the downstream guide. When the tube is completely secured in the tube guide, the pump door is closed and the programming can begin. Be sure to hear the click as the door lever is closed. The pump can then be powered on and the drip detector put in place while it completes its booting up. The IV clamp is rolled open to prevent occlusion before the patient. Setting up the machine is fairly intuitive. Your drip rate is drops per hour. Hit the select IV button once and then use the up and down arrow to set the drop factor. Remember, this is on your packaging. Confirm it by pressing the Set Confirm button. Now adjust the flow rate by pressing the Set button once and adjust your flow rate per hour with the up and down arrows. Then confirm it by pressing the Set Confirm button. The only thing left is to let the machine know how much fluid it has to monitor. This is important because the machine can end up pushing air into the patient's vein if it is not adjusted correctly. Press the Set button twice and enter the total volume of fluid that you have hung. Confirm by pressing the Set Confirm button. You press the Start button to have the machine function and see the fluid run. Now it's time to hook this up to the patient and monitor for infusion alarms to indicate things like air bubbles, fluid exhaustion, or occlusion.